Walk into any pharmacy or supplement aisle today, and you'll find an overwhelming wall of options. Fish oil, calcium, vitamin K, herbal blends promising better heart health, better sleep, better everything. Most people over 60 take at least one of these. Many take several. But here's what cardiologists and pharmacists consistently warn about, and what the FDA and American Heart Association have both published specific guidance on. Some of the most common supplements, when combined with each other or with heart medications, can meaningfully increase the risk of dangerous bleeding or cancel out the medication you're relying on to protect your heart. Today, we're walking through 4 specific supplement combinations that cardiology and pharmacy sources flag most often, why each one is a concern, and what to bring up at your next doctor's visit. This isn't about scaring you away from supplements. It's about making sure you're not accidentally undoing the good you're trying to do. Let's get into it. Fish oil is one of the most widely recommended supplements for heart health, and there's real research behind its benefits for triglycerides and cardiovascular support. But the FDA has specifically flagged that fish oil, aspirin, vitamin E, and prescription blood thinners like warfarin can each thin the blood on their own, and taking them together can increase the potential for internal bleeding or stroke. This doesn't mean fish oil is dangerous for everyone. It means that if you're already on a prescription blood thinner, adding fish oil, especially at higher doses, is specifically the kind of combination your doctor or pharmacist needs to know about and monitor. This one works in the opposite direction. Vitamin K plays a direct role in your body's blood clotting process. It's literally part of the mechanism that makes blood clot. Blood thinners like warfarin work specifically by interfering with that process. Taking a vitamin K supplement while on warfarin can directly counteract the medication, according to guidance from Mayo Clinic and the American Heart Association, potentially making your blood thinner, meaningfully less effective at the exact job it's prescribed to do. Doctors don't necessarily say to avoid vitamin K entirely. Leafy green vegetables contain it too, but they do say to keep your intake consistent and never add a vitamin K supplement without your doctor knowing, since sudden changes are what cause the real problems. St. John's wort is a popular herbal supplement, often used for mood support. But according to Mayo Clinic, it's one of the most broadly interactive supplements that exists. It can make several major categories of heart medication work less effectively, including calcium channel blockers and statins like atorvastatin and rosuvastatin. The FDA has specifically warned that St. John's wort can make medications for heart disease less effective, alongside similar warnings for HIV medication, antidepressants, and birth control. If you're taking any heart medication and considering St. John's wort, this is a direct, specific conversation to have with your doctor or pharmacist before starting it, not after. Calcium is one of the most commonly taken supplements among adults over 60, usually for bone health. But according to pharmacy guidance, calcium can interfere with how your body absorbs certain other minerals, including iron and zinc, and can also interfere with the absorption of some prescription medications if taken too close together. The specific concern pharmacists raise most often is timing, not necessarily total avoidance. Taking calcium within the same hour as certain thyroid medications or specific antibiotics can reduce how much of the medication your body actually absorbs. The general guidance is to space calcium supplements at least 2 hours apart from other medications unless your doctor or pharmacist has told you otherwise for your specific prescriptions. Consider someone like a 68-year-old managing high blood pressure with a prescription blood thinner, who also takes a daily fish oil capsule for heart health, a calcium supplement for bone density, and recently added St. John's wort after a friend recommended it for better sleep and mood. This is a composite picture, built from the kind of supplement stacking pattern described in pharmacy research on cardiac patients. Not a real person, not a testimonial. Individually, each of these supplements is common and often reasonable. Combined without a doctor or pharmacist reviewing the full list together, this is close to a textbook example of the exact combinations flagged in the research above: a blood thinner alongside fish oil and a heart medication alongside St. John's wort. This is illustrative, a composite built from published interaction patterns, not a specific person's medical outcome. The right next step in a situation like this isn't necessarily stopping anything. It's bringing the complete list to a doctor or pharmacist for a real review. Here's the single most useful practical step from all of this research. Bring a complete written list of every supplement and medication you take, including over the counter products and herbal supplements, to your next doctor or pharmacist visit, and ask them directly to review it for interactions. Pharmacists specifically are an underused resource here. Most pharmacies will do a full medication and supplement review, often for free, without needing a separate doctor's appointment. This is precisely the kind of check they're trained for. Don't stop any supplement or medication on your own based on this video. The goal here is to bring accurate, complete information to the people qualified to review your specific combination, not to make that call yourself from something you watched online. We want to be straightforward about something most videos in this space skip over. Not everyone taking these combinations will experience a problem. These are documented risks and known interaction mechanisms, not guarantees of harm in every individual case. Your specific dose, your specific medications, your kidney and liver function, and your overall health all affect how significant any of these interactions actually are for you personally. It's also true that some of this evidence comes from case reports and known pharmacological mechanisms rather than large randomized trials specifically designed to measure harm from these exact combinations, which is common and expected for supplement interaction research, since it would be considered unethical to deliberately test dangerous combinations on people in a trial. The honest summary is this. These four combinations are consistently flagged across major credible health sources, the FDA, the American Heart Association, and Mayo Clinic among them, as ones that specifically warrant a conversation with your doctor or pharmacist. That's a meaningfully lower bar than definitely dangerous for everyone, but a meaningfully higher bar than nothing to think about. So here's the recap. Fish oil alongside blood thinners, vitamin K alongside blood thinners, St. John's wort alongside heart medications, and calcium taken too close to certain other medications. Four specific, well-documented combinations that cardiology and pharmacy sources say deserve a real conversation with your doctor or pharmacist, not a guess. If you take any combination of these, the next step isn't panic, it's your next pharmacy visit. Bring your full list, ask for a review, and let a professional who can see your complete medical picture make the call. And one more time, because it matters. Don't change anything based on this video alone. Use it to ask better questions at your next appointment. If this kind of research-backed breakdown is useful to you, consider subscribing. We go through published guidance like this every week, always with sources, always without hype. And if you know someone whose kitchen counter looks like a small pharmacy, this might be the video worth sending them today.